Hello and welcome to this short revision video on extrinsic risk factors for injury. As always, when we're revising, we need to make sure we've got the specification to hand. We're checking that we're covering all the content that the specification requires and making sure we've got our word world filled out with those key definitions. So this video is referring to extrinsic risk factors. We're going to have a look at poor technique and training, incorrect equipment and clothing, and inappropriate intensity, duration and frequency of activity as extrinsic risk factors for injury. So an extrinsic risk factor then is an injury or risk or force from outside the body. Remember, an intrinsic risk factor is something from within the body, whereas an extrinsic risk factor is an injury, risk or force from outside of the body. So we're going to have a look at a few examples. So the first subheading in the specification was poor technique and training. And if a player is playing with poor technique or they've trained poorly, then that's placing an undue strain on the muscles and tendons and ligaments, and that's the thing that's going to really lead to the injury. So poor technique can lead to chronic injuries, and it can lead to acute injuries. So chronic injuries like tennis elbow are often down to poor technique as well as overuse. For example, tennis elbow might be caused by poor backhand technique. Repetitively playing the backhand with poor technique is going to lead to chronic injury over time, specifically tendinosis of the tendons in the elbow of the playing arm. But poor technique and training can also lead to an acute injury. So a weightlifter lifting gym equipment incorrectly might strain a muscle, or a rugby player who goes into a tackle incorrectly might suffer injury or concussion. The example in the picture there is actually a player tackling too high on another player, and they're going to cause an acute injury on somebody else because of their poor technique. Because coaches are responsible for teaching correct technique to players, they're doing that obviously to improve performance, but they've got to do that in order to help their players avoid injury as well. And this is why poor technique and training comes under extrinsic risk factors rather than intrinsic risk factors, because that poor technique and training effectively is down to the coaching, the poor coaching. Okay, the second subheading under extrinsic risk factors on the specification is incorrect equipment and clothing. So first point is about the fact that the equipment shouldn't be too big or heavy for a performer. If it is too heavy, like the person there lifting a weight that's clearly too heavy for them, that potentially could lead to an extrinsic risk factor due to the incorrect equipment. Also should be relative to a person's size as well, so not too big. For example, and a brilliant example of this is in tennis. They have short-handled tennis rackets to ensure that undue strain isn't passing through the bones and the joints and ligaments and tendons of young tennis players. They would use a short-handled racket. That makes the technique a little bit easier. The racket and the ball is easier to control as well, but it is about those extrinsic risk factors. Second point is about the fact that some protective equipment in some sporting contexts is compulsory. So gum shields, shin pads are compulsory in lots of different sporting contexts. Or sometimes it can depend on a player's position. It's a good idea here to think about the sport that you play. Is there any protective equipment that you have to wear in order to keep safe? Has the national governing body for your sport brought in any rules to ensure the safety of its players by removing that extrinsic risk factor of incorrect equipment or clothing? And the last point here is about sweat-wicking fabrics. It's about clothing, really. A player wearing sweat-wicking fabrics, for example, a long-distance cyclist who might be cycling in hot weather, that's going to help them thermoregulate, keep their body temperatures down, prevent them from overheating, prevent them from dehydrating. But secondly, clothing can refer to footwear as well. So this can be about, those long-distance runners that maybe are wearing trainers that have a lot of cushioning in order to reduce impact, for example. And the final subheading on the specification for extrinsic risk factors is inappropriate intensity, duration and frequency of the activity. So if training sessions are too intense, it's going to place undue stress on the connective tissues, on the muscles and on the joints. That could lead to acute injuries. Also, if the duration and frequency of sessions is too long or too frequent, again, tendons might become inflamed, and that's going to again lead to acute injuries such as tendonitis and chronic injuries such as stress fractures and tendinosis. And that's it for our extrinsic risk factors for injury.